Hello there, sorry to hear about your recent illness. I hear that your latest test is negative, so we're just going to do a few health checks in the clinic today, just to cover a few bases and see how things are looking. Okay, so let's start off just by checking your temperature. Non-contact device here. As you relax, we'll just hold it against the forehead and see what kind of reading we're getting here. Okay, we're getting 36.4 degrees there. It's a good sign. So hopefully you are on the road to recovery. Right, moving on. Let's have a little look at your vision. So, has your vision been okay during your period of illness? Okay, cover your left eye. So what letter you see, please? Keep that eye covered. I'm going to take the target back a little bit. Okay, just cover the opposite eye next. Okay, I'll cover the eye. Good looking vision there, thank you. Sometimes the pupils can be affected with a virus, so I'm going to use the pupil measuring scale here in a second. Let's just have a little look for any gross anisocoria. Just relax. Just using the naked eye there, the light source looks fairly equal to me. Okay, just keep looking straight ahead. Try not to look left or right. To check the individual pupil sizes using some form of scale there. Excellent, so it looks like we have pupil sizes in these conditions equally at 5 millimeters, so that's a good sign. And obviously we want to check the pupil light reactions, so if we've got normality there. Keep looking straight ahead, little light source. Do each eye to check the direct and then the consensual responses. We just ensure there's no relative afferent pupillary defect. Thank you. I'm going to have a little look at the conjunctival surface, making sure that there's no signs of edema. redness, those kinds of things. Anything that could be associated with ocular virus, including watering as well. So I'm going to use two magnified light sources to keep the distance between us. Your job is to look straight, please, to begin with, and then I'm just going to check the conjunctival membrane on the lateral areas. And I look to the right, I look to the left, just looking up, looking down. Okay, just take a blink. Have your eyes been extra watery recently? Any redness to the white surface of the eye? Let's check the left eye. Let's keep looking straight. Certainly seems to be no edema thus far. Look to the right, please. We'll just check the temporal surface there. Now look to the left. Looking up to the ceiling. As the inferior is on there, looking fine. There's no redness. Okay, just look down. Okay, that's looking fine. Thank you. So the eyes themselves, visually, and on the external areas, is looking fine. Pupils themselves are fine. So that's good news. Now let's move on to having a look inside your mouth. Now, with your illness, have you experienced any problems such as loss of appetite, problems swallowing, pain in the mouth at all, any ulcers? Okay, so just a loss of appetite. Alright, so I'm going to have a look inside the mouth now. Okay. Open wide. Okay, just say ah. And again. And once more. It's a very objective test, so just relax. Good. Have you had any problems with your breathing? Blocked nostrils? Blocked airways? Let's have a little look inside the nose then. Start with the right nostril. Checking grossly, and then we'll look through the otoscope window, just the external first. Any inflammation? Got to look inside the airways now. Blockages, polyps. Right nostril's looking fine. Just got to look at the left nostril there. Okay, there seem to be any blockages. The airways, inflammation. So the level of mucus is relatively normal. Looking at each nostril there. It's a very good sign there, thank you. Right. I want to have a little feel of your lymph nodes now, just before having a look, investigating the ears. Okay. Just relax, please. Looking for any swelling. Move down the neck now. Good. Seems to be recovering well. Keep looking into the distance for me. I'm just going to do a little cover test. A little bit of exophoria there. Now, during your illness, did you experience any double vision? Okay, is it usually distance or near? And how long does it seem to last? And it's more when you're watching the television. Right. What we'll do is then we'll have a little look with the prism bar here. This is the prism bar because we saw a little bit of exophoria in the distance. I'll be using the base in setting just to see if we can increase the ocular comfort as you're looking in the distance. Okay, just tell me which amount of prism feels most comfortable as you're looking into the distance, please. Okay, so that's a little bit too much. Let's reduce the prism down. Okay. That feels good there. Just a little bit more again then. Okay, so it looks as though we have two diopters base in there out of the right eye. Not sure if that's going to help with the double vision, looking at the telly intermittently. Might be something we can mention to your optometrist. And they can measure and prescribe prism in your spectacles. Let's just confirm that with the prism. And we'll come down a little bit to the area of most comfort. Two diopters there, two diopters. Okay, thank you. Have a little look inside your ears. Now, during your illness, Any problems such as ear pain, loss of hearing, any discharge? Just look to the left hand side then. Look through the ear canal for any problems. Make sure everything's looking okay there. Wax discharge. Got tympanic membrane. Lovely. So good right ear. Look to the right side for me, please. Let's have a look at the left ear for you. Sure that there's no redness or discharge there. And a closer look at the tympanic membrane. That's looking fine. Okay, so looking inside the ears, very good, thank you. Right, just do a little hearing test using the tuning fork here. We'll ring the tuning fork, hold it next to the ear like so. Just tell me when you stop hearing the sound, please. Just tell me when. And for the left side. Tell me when you stop hearing it, please. There. That seems about equal, thank you. Okay. And the forehead we go. Hearing it more right, left side, or about equal. Okay, if we just change and repeat that one now. More right, left, or about equal. Thank you. So everything's looking a lot better than it was. You're obviously testing negative. My tests are looking fairly normal. Just that slight issue about the double vision when you're watching the television. It's intermittent stages. And we did measure that there was about 2 to 4 base in. It may help the exophoria. So I want you to have a look at this with your optometrist and get them to have a look inside your eyes as well, just to make sure everything's okay, and maybe do a visual field test and check eye pressures. Other than that, everything's looking good, so keep drinking lots of water and just try and rest at home as much as you can. That's everything, and I'll see you next time.